Hello, good morning, good afternoon, good evening. Welcome to our channel, All You Need to Know About Medicare. My name is Jose Sanchez from Senior Health Advisors, and in this channel, all we talk about is Medicare. In today's session, we're going to go through Medicare Part B. That's B as in boy. Okay, for all of you that don't know, Medicare is the health insurance policy that's provided to you by Medicare once you turn 65 or in case that you have been disabled for 2 years. Now Medicare has both Part A and Part B. In a previous session we talked about Medicare Part A. So today we're going to go and delve very deep into Medicare Part B. Okay, Medicare Part B is also known as the medical insurance, and what it does is very simple. It covers you for anything that they do to you while you are outside of the hospital. What does that include? That includes your doctor's visit. It includes any specialist, lab work, any outpatient surgery that you get done. All of that gets covered by Medicare Part B. Now, here's what happens with Medicare Part B. There is a cost associated with it, and if your income is below a certain level, the standard Medicare Part B is $170.10. Now keep in mind, we are talking about the year 2022 because that Medicare Part B changes every year. But for this year, 2022, it is $170.10 unless you make more than a certain amount of money. And of course, how does Medicare Part B works? Once again, very simple. You show your Medicare card and you do have to pay a deductible for your Medicare Part B. That deductible in 2022 is $233. So the first time that you go to your doctor specialist, you will be responsible for the first $233. After that, you have to pay 20%, which is known as a coinsurance. So Medicare will pay 80% and you will pay 20%, which is really not a lot if all you do is just go to your primary care doctor or a specialist. Because let's say if your primary care visit is $100 after you met the deductible, now you only have to pay $20, which will be 20%, which is not that bad. Unless, of course, something bad happens. And let's say if you get an outpatient surgery, which will cost $20, $30, or $40,000, well, guess what? Now 20% of $20,000, we're talking about real money. And that is the reason why most people decide to get some sort of coverage, either through a Medicare Advantage or through a Medicare supplement. Once again, a Medicare Part B, very good to have, especially because it will complete the traditional Medicare, which is Part A and Part B. Another good thing that you have when you have your Medicare Part B is that you can go to any doctor that will accept Medicare. Now, not all your doctors will take Medicare, but the vast majority of doctors will. Okay, I hope this answers all the questions about your Medicare Part B, and I'll see you next time when we go and do Medicare Part C. Thank you and have a wonderful day.